September 16, 2013, movie analysis upload. Heather Blair. The movie I have chosen is John Q. This is a drama with Denzel Washington, who plays the father of an ill child having problems with his medical insurance. The issues in this movie are about medical insurance coverage and how that can affect our lives and the lives of our loved ones. John Quincy Archibald learns of his son's heart disease after he collapses at the baseball field. Due to reductions in his hours at work, his medical coverage has changed, and he learns that this procedure is no longer covered on his plan. Due to this, the hospital expects a large down payment before they will put his son on the transplant list. The procedure itself is $250,000, and they expect a minimum payment of $75,000 before they will begin. He attempts to do what any father would do in this situation and turn his assets into cash to assure his son's place on the list. When the amount of money that he and the community have risen is still not enough, this desperate father takes matters into his own hands and goes one step further to get his son on the list. He goes to the local hospital and takes strangers as well as Michael's cardiac surgeon as hostages to try to force administration to put him on the list. Resolution takes place after the near sacrifice of John Q's life and the change of heart of hospital administration. Michael gets placed on the list, which results in his son's survival. Overall, this movie depicts a healthcare system that favors the rich and well-insured while refusing adequate care to the un- and underinsured. This movie raises many questions and speaks about the financial burdens of many Americans today. So who is essentially responsible for the health care of the child in this movie? Is this movie about affordable, accessible health care coverage? Is it about medical coverage entitlement, where people get the highest level of care despite their ability to pay? In our society, many of us have insurance through our employers. This coverage is based on things other than health, and insurance gets to decide what is covered and what is not. So just because you have health insurance does not necessarily mean that illnesses or catastrophic events or diseases are covered. Many times employers' coverage agreements say that payments of certain diseases or treatments are not worth the price that they would have to pay to cover them. Because the employers pay, they are the decision makers in these situations. So to what extent are employers responsible for the health of their employees? In our society, we allow employers to assume responsibility for health care coverage, so what accountability is appropriate? Are people satisfied with the health care coverage today? That depends on if they're healthy or have chronic illnesses. If people are utilizing their health care on a regular basis, they tend to be less satisfied due to deductibles and copays that they pay each year. Not only that, but many are not satisfied with coverage due to high costs of premiums. If you are not using your insurance on a regular basis but are still forced to pay high premiums, this poses a problem. Many Americans today are working solely for insurance coverage. In my current job, my insurance premiums are costing my family alone $800 a month, and we rarely have a claim. We would probably be better off to take that money and put it in the bank. That is $10,000 a year. What could $10,000 a year do to my family if it was in the bank and accessible to us to use? We are healthy and only go to the doctor for routine medical visits. Many others where I work are faced with the same financial dilemma. So we opt not to take out insurance at all on ourselves or our families and risk the consequences. It makes many of us debate about the worth of even having medical coverage. Many individuals are not satisfied with buying peace of mind with their insurance premiums. But at the same time, what would we do if we had a catastrophic event such as mentioned in the movie John Q? Many insurance companies have insurance caps. If you have chronic illnesses, these caps are met early on in many instances. For example, I gave birth to a daughter at 24 weeks gestation. She was in the NICU from birth until she passed away at 7 months old. During that time, she accumulated a medical bill in excess of $1.5 million. The insurance we had a lifetime cap of $1 million. We exhausted this amount of money early on in her short life. If we had been fortunate enough to bring our daughter home, what would we have done to meet her health care needs financially? This would have been extensive. It is frustrating, and I have heard many of my colleagues express concern about their health care coverage as well. Many times in my career, I have seen patients turned away due to lack of medical coverage. The ones who suffer are the middle class, who work every day but do not benefit from any government programs. My brother-in-law was suffering with severe abdominal pain for over a year. He was in his late 20s and no medical coverage for himself. He could not find a local doctor to see him without substantial payments. I finally got one of my colleagues to see him without having to pay the initial office visit. He was subsequently diagnosed with colon cancer. It took just as long for the surgeon to find him an oncologist to accept him for medical treatments without insurance. And even with no insurance, the inability to continue to work full-time and the cost of his medications and treatments, he was still unable to get a medical card. This left him and his wife in debt for hundreds of thousands of dollars that they will be paying on for a lifetime. Another example of those with insurance who is left in need is my mother, who is diagnosed with fibromyalgia. She has tried all the prescribed medications for this ailment without relief of her pain. There is a new drug on the market that has proven to help many of the patients that I had care for with this disease. Her doctor prescribed this for her, but because the cost was too high, her insurance would not cover it, despite her failed response with other medications. Should she have to suffer just because the cost is too high? This creates the biggest question of all. Should our country offer socialized health care? Health care that is government regulated and provided to all citizens. This is offered in many other countries and has proven to be a disaster. Free government programs are never free. Taxpayers pay for these programs. Many times government programs are inept, and the higher costs have to be paid with higher taxes, spending cuts in other areas such as defense, education, or even medical research and development. This is not a compromise that many Americans are willing to make. Competition is removed in these situations so the individuals lose their right to control their own health care options, and competition has always led to greater cost control and effectiveness. This in turn creates monopolies in the insurance industry, and it removes the supply and demand need that keep costs down. This means that government officials, not citizens, predictably decide who gets medical coverage and who does not. This leads to decreased patient flexibility. Who is to say that who abuse the system with multiple drug transactions or doctor's visits will decrease this behavior just because their medical coverage is free? In my opinion, this free health care would make their behavior worse and drive costs for insurance even higher. Why should people who take care of their health have to pay for those who abuse their bodies and our system? With a standard reduction in payment for care, many physicians would be deterred from this profession. What would happen to our personal liberties if the government passed additional limitations or increased taxes based on our habits or our lifestyles? With the government regulating what services, equipment, drugs, and such that we are entitled to, ethical differences could decide who gets what services, treatment, etc. With new insurance programs trying to be enforced today in our society, we wonder what is best for our country and its citizens. Despite all the research I have done about the different types of healthcare programs, their advantages and their disadvantages, I still think that we have in America a superior program to other countries. I feel that one of the most important aspects to life and our freedom is that we be able to control our own health care. The end.